Hi everyone, Dr. Nemechek here. I just want to go over some words that we use when we just don't feel right. Now, what we're going to talk about is vertigo, where you're spinning, and then what's called lightheadedness, where you think you might pass out. Okay? So, I'm really lightheaded when I stand up. I mean, literally, the lights are going to go out. That's kind of one side. That's a low blood pressure to the brain problem. Now you need to see your doctor. You might have a heart rhythm problem, anemia. Maybe you're over your diuretic, your blood pressure meds are too high, or you're developing diabetes, lightheaded. You got to go see a doctor. Okay, it's an important thing. Other side of the spectrum, vertigo, spinning like you're in a carousel at the fairgrounds. Okay. Can happen when you're laying down. Often just change of position. So you look over your shoulder in the car, or if you look up, or some people, they just roll in bed and they start spinning. Okay, that's a balance problem from your balance mechanism in your head. They often talk about Meniere's disease in their ear, and you've got these stones that are loose and everything. Another really, really common cause of this that they don't talk about much, unless you're a primary care doctor, is sinus pressure and sinus congestion. It doesn't have to be major, but it's very common. So there isn't much they can do if it's the pure neurological stuff. There's this stuff called Epley maneuvers where they try to move your head around and help it. But go get some Flonase first if you're like spinning a lot, and see if that'll clear it up in just a few days. Okay? Now, so you have these two things, very different words. One's lightheaded, low blood pressure to the brain, I think I'm going to pass out. The other is I turn my head in little funny positions and I'm spinning like on a carousel. If you have a little bit of this or a little bit of that, people start using words like off balance or dizzy. Okay? And I don't blame you. I'm just saying, as a clinician, this is how we've got to separate these things. And because if you go to your doctor and you say, I'm dizzy, but really you're noticing it when you're upright, like you're going to pass out, they may think you got the ear problem. Okay? Or if you're like, I'm just off balance. Both of these can make you feel off balance. We call that disequilibrium. It's this sense like, man, I feel like I'm on a boat or something. It's kind of moving. That can be either low blood pressure in your head or the inner ear problem. Okay? So you have to kind of think about it a little bit more and to try to help sort out what it is. Now, if you have this low blood pressure problem, so here's your head, and you're having trouble pushing blood in your head, typically your low blood pressure problems go away when you're flat. You don't have this weird sensation. Why? You get rid of gravity. It's easy to get pressure in your brain. But if you have the vertigo problem, that's just a change of position. That can be, I'm in bed and I just roll over and sometimes I get it. Okay? That's not going to be from low blood pressure. That's going to be from the inner ear problem or the sinuses triggering the inner ear problem. Okay? So you got this dizzy, uneasy, off balance. It's either going to be a dizziness thing, okay, which is, turn your head, stuff like that will trigger it, or a low blood pressure thing, which is more when I move to the upright position, I feel it, or if I'm standing or sitting still for a while, your blood pressure will start dropping, you're feeling it, okay? So as you're thinking about this dizziness stuff, you got to kind of look in either of these and help yourself figure out a way to the answer. So hope that helps. Everybody have a great day. Take care now. Bye.